Is the link on Facebook?
Good evening. Good evening. All right, now I'm on camera. All right. Good evening and welcome to April's edition of the Ask Mary and Pat Show featuring Ms. Mary Fenner and Ms. Pat Boga. Tonight we will have Ms. Pat Boga along with our special guests who are also navigators and assistants for the Oak Hill Regional Community Development Corporation. We are so glad that you are joining us this evening from wherever you may be, whether it be on Facebook or our YouTube channel. Please share, like, and invite a friend. My name is Thomas Robinson, but everyone just calls me Duke. I am the Technology and Metrics Director for Oak Hill Regional CDC, which is the parent corporation of Healthy Kids Mississippi. We recognize our board chair, Jennifer Garrett, our executive director, Dr. Michael Miner, and our project director, Mrs. Lottie Miner. Once again, in addition to the Zoomcast, we are restreaming this evening's webinar on our Oak Hill Regional CDC and Healthy Kids Mississippi Facebook page. So once again, feel free to like and share. Please tag a friend and tell their friends to tag a friend. We would like you to be more informed about Medicaid and CHIP and also the ACA special enrollment period. Please feel free to ask any questions in the Zoom chat or as well as on Facebook. If we do not get your question tonight on Facebook, we will make sure we get back to you in a timely manner. We will do our best to respond to each question. Our next Ask Mary and Pat show will be May 22nd. I know we are used to having our Ask Mary and Pat show on the last Monday of every month, but since next month, last Monday is Memorial Day, we will move it up a week, which is May 22nd, and it'll be at 6 p.m. And now, without prolonging any other time, I'm going to turn it over to Miss Pat Boga and our special guest, Miss Pat Boga.
All right. Good evening. Good evening. We thank you, Duke, and of course, we appreciate you for being the most fantastic engineer. And of course, we want to thank Brother Campbell for joining us on tonight. Sister Fenner, Mrs. Mary Fenner, and Ms. May Stigler, they were not able to be with us on tonight, but we're going to try to hold it down, well, for the next hour or less. And we'll go ahead and have Brother Campbell introduce himself before we get started with the questions and answers.
All right, good evening, everyone. And I'd like to thank Sister Boga, as well as Sisters Finner and Stigler, as well as the entire staff of Oak Hill Regional Community Development Corporation for the opportunity to be with you tonight. Okay. I serve as primarily a navigator with Oak Hill Community Development Corporation. In my role as a navigator, my primary position or function at this position are to help people obtain health insurance coverage through the marketplace, also known as the Affordable Care Act, or commonly known as Obamacare. And there's a lot of different ways that one can qualify for this coverage. And it's my job to try to help people find whichever way that they are able to qualify for this coverage and help them get signed up with an account, create an application, submit the application, and then help them choose a plan with hopefully advanced premium tax credits that will reduce their monthly premiums to an affordable rate. I also serve as the education coordinator for Oak Hill Community Development Corporation, which just means that I try to help new navigators, staff become acclimated with the processes that we use. And it's a pleasure to be here this evening.
Right. All right, thank you. Well, we'll go ahead and get started. Of course, first question we have is, I am pregnant and enrolled in pregnancy Medicaid. How long will I be on Medicaid after I have my baby? Now, the answer to that question is the postpartum Medicaid was recently extended in the state of Mississippi. And of course, that means you will receive Medicaid for yourself up to 12 months after you give birth to your baby, okay? So it originally was only 2 months after, but it has been extended to 12 months. So this will allow you more time and a chance to receive proper medical care for postpartum issues. So again, you will have 12 months now. Okay, we have another question. I received a postcard in the mail from Mississippi Medicaid, Ray, updating my contact information. What is this for? Excuse me. Well, this is very important. So you may receive a postcard, you may receive an email, you may receive a text message, or you may receive a letter from Medicaid. But what you need to do is you need to contact your local Medicaid office or your state Medicaid office to make sure that they have your correct phone number, address, and email address. And of course, they have your address if you've already received a postcard. Now, the COVID-19 public health emergency ended effective March 31st of this year. And of course, this means that for the last 3 years, you may not have had to even complete Medicaid renewal. Okay, now some offices have been doing it, but some haven't, because with the public health emergency, that means that you didn't have to, the Medicaid office didn't have to renew your coverage because they were making sure that you had the proper insurance or medical care during the COVID pandemic. So again, renewals, they are going to start back up. Actually, after the public health emergency ended on March 31st, they should have already started up, but the Medicaid office has up to 12 months to make sure that they complete your Medicaid renewals. And there are some of their Medicaid is going to be terminated because either their income is too high or over the limit, or that child that was on Medicaid, and Medicaid was supposed to have ended on when they turned 19. And of course, there are some, they're 20, 21, even 22, still on Medicaid or CHIP. Well, that is going to end within the next 12 to 14 months. So just be on the lookout for your letter. And of course, don't panic over that, because Brother Clarence Campbell, he mentioned earlier, you know, he told us about his title and what he does. So we're going to ask him to come back on again and just let you know that, you know, because your Medicaid may be terminated because you've gone over the income limit for Medicaid CHIP, or you are getting ready to be terminated, or you have been terminated because you're 19 and older. Okay, Mr. Campbell. Okay, I believe he's muted. And as soon as he unmutes, he's going to let you know. Okay.
Share. Sometimes it doesn't always work quite as smoothly as we would like. Screen sharing.
It's all right. It was last minute. I do apologize for that.
Okay, hopefully this screen is being shared. We should have a picture of a website that says special enrollment periods.
Yes.
Is that what?
Let's see that. Yes.
That is what's up there now.
Yes.
Okay, so special enrollment periods. Individuals that currently have coverage through Medicaid, or you may have coverage through your employer. We may have CHIP coverage or just some other type of coverage that's ending. Or you may have some sort of circumstance in your life that changes. Special enrollment periods allow individuals to be able to apply for coverage outside of the open enrollment period. And this is coverage through the marketplace, the Affordable Care Act marketplace coverage plans. There are different conditions that will qualify you to apply for a special enrollment period, which will allow you to apply for coverage and enroll in some type of coverage through the marketplace. The first one of these, and I'll go through a few of them, life changes that can qualify for a special enrollment period. There's changes in your household, such as you get married, you had a baby, adopted a child, placed a child for foster care, you got divorced or legally separated, somebody on the plan died, you had a change in residence, you lost your health coverage. You may qualify for a special enrollment period if you lost job-based coverage, individual health coverage, Medicaid, or the Children's Health Insurance Program, CHIP, or were denied by Medicaid or CHIP, or if you lost eligibility for Medicaid. All these different circumstances will qualify you for a special enrollment period, which means that you can apply for coverage through the marketplace. Now, one thing I need to emphasize with marketplace insurance is marketplace insurance does not replace Medicaid. It does not replace CHIP, Children's Health Insurance Program. These programs, Medicaid or CHIP, are programs where coverage is essentially free for the applicants and those that are enrolled in it. Marketplace coverage is insurance that you buy. And the amount that you have to pay for your coverage depends on, again, a variety of different circumstances. First of which is going to be your income, your household income, your family size, your age, and then a few other variables. But certainly we want to encourage everybody to have coverage because statistics have shown that people who experience large medical bills are in the group that's most likely to have to file bankruptcy. Unexpected medical bills can create a horrendous financial burden on people. And quite often you can get yourself in a position where you have to file for bankruptcy in order to be able to kind of get out of this. So having some type of coverage can help you maybe stave off having to go into bankruptcy.
Great, great. We thank you. Okay.
Welcome.
Okay, we thank you for sharing that information. So basically, we want to let them know that it's not the end of the road. Medicaid is CHIP. They're not the end of the road. Okay. Now we do have another question. And of course, that question is, I received an email from Medicaid stating that my child's Medicaid was up for renewal. I've never received an email communication from Medicaid before. Why is this happening? Okay, this is another one of Medicaid's efforts to reach out to you and to let you know that, again, we've been talking about the public health emergency, the end of the COVID-19 public health emergency. Okay, a lot of you may have gotten comfortable with not being able, not having to renew your children's Medicaid each year. Okay, so this is just one, as I mentioned earlier, this is just one of their ways of communicating with you. Again, you could get a phone call, you could get a text message, you could receive a postcard, you can receive an email as you did, and you can also receive a letter in the mail. But the most important thing is to make sure that you read it thoroughly, and if you're to respond, make sure that you respond promptly, because we don't want your Medicaid to be terminated just because you didn't respond. Okay. And of course, right now, I'm just looking at some of the statistics. There are over 880,000 consumers and families in the state of Mississippi that receive Mississippi Medicaid. And of course, you may think that their goal is to keep you off of these services, but they are trying to help you to make sure that you maintain health insurance coverage. So please, please respond. If there's a question that you need to respond to on that email, you do that, okay? And of course, some are receiving letters as well. Well, before we go to another question, Duke, if you don't mind, let's take a commercial break.
There are Mississippians applying for health insurance that may not qualify for a program. However, we all know it is important for families to have health insurance. This is why Healthy Kids Mississippi has been working with our state's federally qualified community health centers, or FQCHC, to help our fellow citizens find a medical home. Our organization is focused on raising public awareness about health coverage options for children and their parents through the Medicaid and Children's Health Insurance Program, or CHIP, in the state of Mississippi. Our process is simple. Our organization's assisters seek out Mississippians. Once our assisters gather the necessary information from the consumer, they apply for insurance programs on behalf of them when consent is given. When the application process is complete, the applicant will find out by mail if their application has been approved. We want to help as many families in Mississippi as we can. To learn more about our organization, please visit us on our website, healthykidsms.org, or give us a call at 662-298-3584. We welcome you.
Thank you. Okay, I see that Ms. Stigler is on the call. I'm not going to put her on the spot this evening, but Mrs. Stigler, if you have any input on any of the questions, feel free to join us, okay? Another question. I have noticed on a friend's Facebook page, she shared a post about a new app called Oak Hill Regional Community Development Corporation. What is this app for? Okay, yes, we do have a new app. And the answer to that question is you can download this new app and you will find information on Get Covered Mississippi and Healthy Kids Mississippi. Those are just two of the programs that Oak Hill Regional Community Development Corporation provides to consumers throughout the state of Mississippi. And of course, Get Covered Mississippi offers assistance with helping you get enrolled in an Affordable Health Care Act insurance plan that offers great insurance coverage to that will suit your needs, and of course that will be affordable. That will be an affordable cost to you. And of course, we're going to let Mr. Clarence tell us a little bit more about that as far as Get Covered Mississippi. He is one of our main and key navigators with the program.
Okay, a little bit about plans that are available through the marketplace. These are the plans. Marketplace is the name of the plans that you get through the Affordable Care Act. Now, there's a variety of different levels of plans that you can purchase through the marketplace. And the premiums are going to range from maybe $0 a month up to several $100s a month, all depending on the different variables such as your age, your income, and your family size. These are the determinants that are going to be used to determine how much you might pay. And then also the level of coverage that you might want. The way marketplace plans are separated out is they call them metal levels. There's 4 metal levels. There's bronze, there's silver, there's gold, and then there's platinum. These metal levels determine the amount of co-insurance costs that you have to pay for. So typically speaking, the more the insurance company pays, the greater your monthly premiums are going to be. The less amount that they pay, the smaller your premiums will be. And then when we say what you have to pay, there's certain items such as your amount of co-insurance. Co-insurance takes into account things such as the amount that you'll pay for an office visit, the amount that you'll pay for co-payments for prescriptions, and the amount of co-insurance that you'll pay for hospital visits, emergency room care, durable medical equipment, all these sort of things. These are all fall into what's considered co-insurance that you have to pay. And then there's also the premium that you pay itself. The premium is the monthly amount that you pay each month. So it's possible to get into, let's say, a bronze plan. It's going to have a high deductible, which means a lot of money that you have to pay out before the insurance company picks up a lot. But your monthly premiums could be zero or just maybe a few dollars a month. Okay, so this may not cover a lot of things, but what this will do is what this insurance will do is it will allow you to receive the 10 essential health benefits that all plans have to cover, such as testing, vaccinations, preventive care. And I wish I could remember all 10 of them right now, but there's a number of services that are available totally free of cost just because you're enrolled in a plan. You may be paying nothing for them. And so now if you're a younger person maybe that has very few health issues, what these bronze plans will do is they'll enable you to receive all the preventive care that's necessary, things such as cancer screening, mammograms for ladies at no charge. If you're a little bit older and then and maybe have some type of particular health condition that requires you to see medical professionals, doctors, specialists on a regular, semi-regular basis, then you may need a higher level plan, a higher metal level plan, such as a silver plan, which will pay a greater percentage of the co-insurance that you have to pay, but your premiums are going to cost you more. But the main thing I would like to emphasize with coverage through the marketplace is the 10 essential health benefits that are covered in the amount of preventive care that you have available to you. And then plus the fact that if you have some type of coverage, it'll get you in the office, it'll get you in the hospital, get some sort of treatment. You won't get turned away or maybe get just given basic emergency treatment to stop the bleeding, and then you're sent on your way.
Right. Okay. And again, that's one of the programs you'll find out more about. But actually, you can complete an inquiry form on the new app. And if you're interested in enrolling in affordable health care insurance, all you have to do is complete that inquiry form there. It's going to give you some more information about Get Covered Mississippi. And there's a photo gallery there. Now, the app is new, so you won't see a lot of photos right now, but it's there. And it'll tell you a lot about the Healthy Kids Mississippi program. And it lets you know the Healthy Kids Mississippi provides information to help you with your questions about Medicaid and CHIP coverage for you or your children. And we do have assisters available. We have application administrators available, as well as assisters that will help you to complete your Medicaid and CHIP application. You know, as I say often, you know, a lot of times you may not be able to get to your local Medicaid office because you may be at work. And sometimes if you miss work, some of the jobs are on point systems. You don't want to lose money by having to take off and get there. So all you have to do is call us at Oak Hill Regional Community Development Corporation. That number is 662-298-3584. And you just ask for an assister or a navigator to help you with Get Covered Mississippi, and you will be directed to one of us. Now, we're available pretty much 365 days of the year, okay? And let me see what else is on the new app. There are links to direct you to our social media pages. And there's also a link to view our locations within the state and within the state of Mississippi. Also, there is a link, well, again, that will give you the locations and a link to our website, our webpage. And of course, if you're looking on the screen, you can see our QR code there. And all you'll have to do if you don't want to take time to, well, either way, you'll complete the inquiry form, but you can scan the QR code and it will direct you right to us. Now that you see it shows, it gives you some information about us, the inquiry form, and also various downloads, okay? So that app is very important. And if you've seen it on your friend's page, we would love for you to share it with their friends and family as well, okay? But we think we're really excited about this app. It was just released within the last few days, and it is going to be a very important part of assisting you with getting services through Get Covered Mississippi, Healthy Kids Mississippi, and as well as federally qualified community health centers. Okay. And of course, our Brother Campbell, do you have any information to share on that app?
Do I have any information to share on the app? Well, like most other folks within our organization, the app is brand new to me and I'm still learning how to use it. But certainly by accessing the links to the app, you'll be able to get in touch with various navigators within the state of Mississippi and obtain the help that you might need, either for Healthy Kids Mississippi or for Get Covered Mississippi, either obtaining healthcare for those on Medicaid or CHIP, or for helping people obtain coverage through the Affordable Care Act. And then also, Ms. Boga mentioned the federally qualified healthcare centers. And I want to emphasize the fact that we have, I think they say that there's like 280 some odd federally qualified community health centers in the state of Mississippi. Now, some of them might be multiple providers at the same location, but these centers are located from the northern section of Mississippi down to the Gulf Coast. And these are places where you can go to obtain very quality healthcare coverage. And if, as you're in the process of maybe being involved in Medicaid unwinding and you've lost your Medicaid, you no longer qualify for that, you may not have enrolled in or qualified for coverage through the Affordable Care Act, and you need medical health, you can always go to the federally qualified healthcare center and they will take care of you. They operate off of a sliding payment scale based off of your ability to pay and also off of any other insurance coverage that you may have. There are individuals within the state of Mississippi that use the federally qualified healthcare centers as their primary care providers. They are enabled to make referrals to refer you to specialists. They can get you to dental care specialists for dental problems that you may have. And I can't emphasize enough about this valuable resource that you have, whether you qualify for coverage through the ACA or through Medicaid or CHIP. This is still something that's available to you. And by using the app, you can get in touch with people that can get you in contact with individuals within our organization that can expedite the process of getting you set up with appointments to visit one of our federally qualified healthcare centers in the state of Mississippi, I'm sorry.
Okay, we thank you so much. And we're going to take a commercial break.
Congratulations! You have successfully selected and enrolled in a marketplace plan. Choosing the right health plan can be overwhelming, but it is important for you to know that the next steps are just as critical as selecting the actual plan. This is why we created this video, to guide you through on how to get the most out of your health insurance coverage. When open enrollment ends, the period known as From Coverage to Care begins. It is an initiative championed by the Centers for Medicare and Medicaid Services, or CMS, to help consumers with new health care coverage understand their benefits and connect to primary care and the preventative services that are right for them so they can live long and healthy lives. Ask yourself questions like, is there a time when I thought I should go to the doctor but didn't? Was it because of the cost? Was I afraid of finding a problem and how much it would cost if I did? Well, finding out early is better for your health and your pockets. Having health coverage relieves the stress of finding and affording healthcare services when you are sick. It is important to familiarize yourself with common health insurance terms. Terms like premiums, co-payment, deductible, and others. This will help you understand the differences between health coverages. After you understand the terms, it is a good time to learn about the different financial assistance options that are available for you, like premium tax credits and cost-sharing reductions. Once you have a basic understanding of health coverage terms and options, it is important to log into your account with your new health insurer provider so that you are able to pay your monthly premium. In your account, you will also be able to view your policy benefits, activity and usage, your ID cards, and also the ability to participate in telehealth. It's important to know where to go for care. Find a DR before going to the ER. By logging into your account and searching for providers in your network, you will eliminate the hassle of going to an ER. Finding the right provider for you is essential in maintaining good overall health. You may want to visit a few offices to make sure you and your primary care provider are well suited. Be prepared for the visit by bringing ID cards, records of your key information, including medical conditions, dates of past surgeries, current medications, doctors' names and contact information, next of kin and contact information, and any drug allergies. During your visit, it is important to be open with your doctor. Asking questions is key to good communication with your doctor. If you don't ask questions, he or she may assume you already know the answer or that you don't want more information. Don't wait for the doctor to raise a specific question or subject. He or she may not know it's important to you. Be proactive. Ask questions when you don't know the meaning of a word, like aneurysm, hypertension, or infarct, or when instructions aren't clear. For example, does taking medicine with food mean before, during, or after a meal? Now that you have a general idea, it is important to remember to make sure you pay the monthly premium and also continue to make appointments and fill prescriptions. Here at Get Covered Mississippi, we are always ready to assist you. Please give us a call at 662-298-3584 or text us at 662-689-9712. Email us at info@getcoveredms.org or visit our website at www.getcoveredms.org.
Thank you, Duke. Thank you so much. Mrs. Aretha Knox, another one of our sisters and applications administrators, as well as the navigator. She is on the call with us on tonight. And so we hope that she can join in with us. And I'm going to put her on the spot. Okay, we do have a question here. I moved to a different location, but in the same town. Medicaid does not have my new address because it's not time for my Medicaid to be renewed. So I haven't contacted the Medicaid office to give them my correct address. Should I wait until it's time for my Medicaid renewal to update my address, or should I do it right away? Okay. I think Ms. Knox is Mrs. Knox is muted at this time. So we're gonna allow her some time to unmute, but we suggest that you contact your local Medicaid office now. Okay, Mrs. Knox?
All right, I would tell them they need to contact their Medicare office now. Give them all the information. When they call the office, they can leave the information there. They have a system set up where you can leave your information and they will give the information to your caseworker. But if you're not sure your caseworker has received the information, you need to call back and ask to speak to your caseworker, letting them know that you have moved to a new location before your renewal time comes. Don't wait until the last minute.
Okay, Mrs. Knox, there's another question. I receive mail and don't always open it right away. I sometimes lay it aside and forget it. Will Medicaid close my case if I don't respond within a certain period of time?
Of course, Medicaid will close your case. That's why it's vital that you all open all mail coming from the Medicaid office. They will give you a certain length of time after trying to contact you and close your case because you're and noted as unable to contact you. So you need to open your mail and address whatever issue there is. And if at any time that you have an issue that you cannot answer, please contact us. We'll be glad to help you.
That's right. That number to call is 662-298-3584. And of course, we have sisters throughout the state of Mississippi. And so don't worry about, calling and reaching someone in North Mississippi and you live in the Delta, or you may even live in the Jackson area. Just call that number and we will direct you to the sister in your region, and we can help you as well.
Gladly.
Okay. Right. Okay. I know my income has exceeded the Medicaid chip limits for my children now, and they are still on chip because of the public health emergency. What are my options if they get kicked off Medicaid and chip? Okay, and Mr. Clarence Campbell has talked a lot about that. So we're gonna bring him back on to let you know that, again, it's not the end of the road. Have no fear. We are still there for you.
Okay, if you're kicked off a chip or Medicaid because your income exceeds limits, you most certainly are going to qualify for, almost certainly you're going to qualify for coverage through the marketplace, through the Affordable Care Act. So if you receive this level of termination, then you should get in touch with one of our navigators. You should call our office at the number that we've been promoting, 662-298-3584, and ask to speak with somebody about obtaining coverage through the Affordable Care Act, through the marketplace. And then you speak with the navigator that can interview you and get your particulars and see what you might qualify for. And then again, in the meantime, make sure that you remember that you do have the availability of the federally qualified healthcare centers. And
Right.
then, I do want to reemphasize that coverage through the Affordable Care Act will probably provide coverage at a greatly reduced monthly premium. It may be $0 a month after you include your advanced premium tax credits, or it may be more. And the only way that we can determine exactly what your particular premium would be to obtain the information from you, create an account, complete an application, and submit it. And then you'll know exactly what you might have to pay for coverage through the marketplace.
Thank you. Thank you. Okay, and I see that those that are asking questions, their question is really similar to some of the other questions. So that means that there is a concern. But this question is, I have 2 children over the age of 19 that receive CHIP coverage. I haven't received a letter from Medicaid yet, and they haven't been to the doctors for any medical services in the last couple of months. So I don't know if they still have CHIP or not since, well, she said, since we've been talking about the end of the public health emergency, what do I need to do to find out? Okay, and the answer to that is, now, if they're over 19 years old, the public health emergency, of course, you've heard, it has already ended. Now, their Medicaid or their CHIP is definitely going to be terminated this year because they have reached the age limit. They're past 19. Now, you may not have received a letter yet, but within the next 12 months, you will receive a letter. So we just want to encourage you, if you are afraid they don't have coverage, you may need to go ahead and reach out to your Medicaid specialist at the Medicaid office to make sure that their Medicaid is still in effect. And if there are any physical examinations or any health screenings that they may need, it may be good to go ahead and get those done, because you will receive that letter at some point stating that their Medicaid or CHIP has been terminated because they have reached that age limit, and the public health emergency again is already ended as far as March 31st of 2023. And one of the things you can do again is contact your local Medicaid office to be sure, just check your mail carefully, and email as well, because they may send you an email or they may send a postcard. And if you haven't had an address change or phone number change, you may not have received your termination letter just yet. You may want to wait a little while to be sure. But the main thing is watch your mail and just be prepared, okay? And Mr. Campbell, again, has been explaining the services that Get Covered Mississippi offers as far as the Affordable Care Act health insurance. And we will be there on standby in case, whenever they get terminated. You can contact us at 662-298-3584, and we can go over plans with you and prepare you to enroll your child in affordable health care insurance. Okay, and Ms. Knox, do you have anything to add to that? Okay, we just want to take a moment to thank each of you for joining us. Okay.
Ms. Boger, it's
Yes.
on the chip card, on the back of that
Yeah.
chip card, it's a number. They can call that number and they can tell them immediately whether their case is still effective or not.
Right.
So if they can't get to their caseworker, call that number on the back of that card, and they will tell them whether the case is closed or not.
Okay, well, that's great. That's great. Again, just find your card and look on the back of it. There's a number, and just contact them and they'll let you know. Okay. Now that's great. That's great. Okay, well, Duke will take another commercial break. And if we don't have any questions in the chat, I don't see any. And do we have anything on Facebook or social media?
We will check during this commercial.
Okay.
CHIP has established itself as a critical piece of the federal state response to children's health care needs. CHIP, signed into law on August 5, 1997 by former President Bill Clinton, was created to build on the success of Medicaid by giving states the opportunity to receive enhanced federal matching funds to expand affordable health coverage to children and families that earn too much to qualify for Medicaid but too little to afford private health insurance. Over the past 25 years, CHIP and Medicaid have sharply reduced the rate of uninsured children in the U.S. Together, they have successfully kept children connected to health coverage and played an important role during recent economic downturns and public health emergencies in the state of Mississippi. The Children's Health Insurance Program provides insurance coverage for uninsured children up to age 19 whose family's income does not exceed 209% of federal poverty level. Families may earn up to 209% of the federal poverty level and be eligible for CHIP. A child must be determined ineligible for Medicaid before eligibility for CHIP can be considered. Children with current health insurance coverage at the time of application are not eligible for CHIP. Our organization, Oak Hill Regional Community Development Corporation, is focused on raising public awareness about health coverage options for children and their parents through our Healthy Kids Mississippi initiative. To learn more about our organization, visit us on our website, healthykidsms.org. Give us a call at 662-298-3584 or text us at 662-689-9712. We are always ready to assist.
Okay, well, we thank you so much, Mr. Clarence Campbell. We thank you so much for joining us on tonight and sharing the information that you have about the affordable health care insurance, as well as special enrollment period. Mrs. Doretha Knox, we always appreciate you so much for stepping in. You are valuable. We appreciate you. And Mrs. Stigler, we thank you for jumping on and joining us on this evening. And of course, we definitely want to thank Duke for being such a wonderful engineer for the program. And again, our contact information is 662-298-3584. If you want to give us a call, if you need assistance with applying for Medicaid or CHIP, or you may need us to help you with the renewals of your Medicaid and CHIP, or you may need to just reapply, or you may want to apply for pregnancy Medicaid. We are available for you, as well as the affordable health care insurance. And Mrs. Lottie Miner, our project director, she is on the call. So if she doesn't mind, we want her to unmute and share some information. We've been talking about the new app. We're so excited about that. And we want to see if she has some information she can share about that and much more. Good evening.
Good evening, everybody. I am so happy to be on tonight. I've not had an opportunity to share with you all. There's Sister Doretha Knox, beautiful face. I think somebody's trying to highlight me instead of her, but go ahead and keep her highlighted. Keep her up there. She's looking lovely. That's all right. Y'all can see me later. If you can't get my face up, that's okay. Can y'all hear me at least?
Yes.
Yes.
Wonderful. All righty. So again, happy to be here tonight. I've been missing these calls just due to some other issues that are going on with me and my family. But this app, y'all, it's absolutely fabulous. I am tech savvy to an extent, but I'm not Duke. I'm not Thomas Duke Robinson. I'll say it that way. But this app is absolutely phenomenal. because it gives us an opportunity. It gives us and the consumer, those of you who are potential enrollees for Medicaid and CHIP or for marketplace coverage, an opportunity to review our information about what we offer in a very, very easy to read, easy to understand format. Even children now know what apps are. So I think this was a wonderful move on the part of our leader, Dr. Miner, and our tech person, Brother Duke, to put this together. Folks who are watching, I encourage you to please, please, please download this app. You can search on your app store, Google Apps, or the Google Store, or the Play Store, wherever you go to download information to your phone, whether it's an Android or an iPhone, it does not matter. It can even be an Obama phone. As long as you have internet access, you are able to download this information. And there are links there for everything that Oak Hill Regional CDC does. Now, that app does not replace the assistance of our team members, of our wonderful application administrators, Sister Knox, Sister Stigler, Sister Finner, who did I miss? Sister Boga. It does not replace the expertise of our navigators, but it gives you an opportunity to review the information on your own in an easy to read way. And you can contact us directly through that app. So it makes it so easy. Additionally, the old traditional ways of getting in touch with us has not changed. You can still call 662-298-3584 and somebody will help you. You can still go to our website. You can still go to our Facebook page. All of that's still available because all we want to do is be accessible. Mississippi is a state that has limited access to a lot of things. And I'll say this, a lot of the limited access goes back to history, how we have historically been a state that has a good little bit of systemic racism, systemic classism, systemic sexism. And normally the people who need these services the most are women, folks who may be middle to low income, people who've not always had internet access, people who may have never had coverage before. So having all these means of contact make it easy for you, the consumer, to get what you need. We don't want to create barriers. Unfortunately, so many agencies in our state create barriers to access. We want to remove those barriers so you get what you need. I think I've talked long enough, but you get the picture. I'm excited about this app. It's fun to look at. It's fun to play with it. So please, ma'am, please, sir, if you haven't already seen it, go out there and take a look. Ladies and gentlemen, y'all are doing a fabulous job. Sister Boga, Sister Knox, I don't know if Sister Finner and Sister Stigler are on. I know Brother Duke is on. You guys are standing on the wall, doing a great job. Thank you for working on behalf of the residents of Mississippi. We appreciate you so much.
Thank you. Thank you.
Thank you.
All right. Thank you, Mrs. Miner. And we're going to turn it over to Duke. We hope that we helped you in any way that we possibly could with the questions and the answers on tonight. And of course, if you have more, all you have to do is just give us a call. The number again is 662-298-3584. And Duke's going to let you know when the next Ask Mary and Pat will be held. And we want you to have a wonderful night.
Great job as always, Ms. Boga. It was such an informative show. We hope everyone tuned in and got some information and they can go and share it in their networks. So also about the app, we've been talking about this app all night, and we forgot to mention that it is free of charge. It is free of charge for anyone. If you have your Apple phone or your Google or Android phone, you're more than welcome to go to the Play Store or the App Store to download it. You can type in Oak Hill Regional CDC, or if you want to, you can type in Mississippi Healthcare Help, and it will pop up that way as well. But we are very, very excited about this new app and what all it will hold for the future, as far as helping Mississippians find coverage, whether it be for ACA, Medicaid, CHIP, or the federally qualified community health centers. So please go download that right now. Just take out your phones wherever you may be. As long as you're not driving, I want to make sure that you're settled please do not be driving to download this app. If you just go to your app store, and matter of fact, I think I can share. I can take a few moments to talk to talk.
Brother Duke,
Yes, ma'am.
while you're sharing the screen, let me say this to everybody. Duke is really, 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 really modest, but I want you guys to know that he was the mastermind behind putting this together. He did the research. He contacted the necessary folk to make this happen. And we want to just, again, thank him for doing a marvelous job.
Yes.
Thank you, Sister Maya. I really appreciate it. But it was just a team effort. It was a team
Oh, I
effort.
know, but you led the process on this. So thank you so much.
No problem. As everyone can see on the screen, we see that we have the Oak Hill Regional CDC app. Whether when you come to the home screen, you're able to choose between Get Covered Mississippi or Healthy Kids Mississippi. These are actually buttons that you can click, and it will take you to their respective pages. If you not really familiar with apps or can't tell that that's a button, you can more than welcome to go down to the bottom and click Get Covered Mississippi or the Healthy Kids Mississippi tab, and it'll take you to the exact same information. So those are interactive buttons that you are more than welcome to click on, whichever one works best for you. And also we have media. It'll list all of our social medias, whether our Oak Hill Regional CDC Facebook, Get Covered Mississippi Facebook, Healthy Kids Mississippi Facebook, our Instagram for Get Covered Mississippi and Healthy Kids, and also for Twitter on Get Covered Mississippi, Healthy Kids Mississippi. So we're on every social media platform. So there's information being shared constantly, whether it's early at 7 in the morning or late before you go to bed at 9 or 10 p.m. There's information that is shared, and some of our posts are shared through Spanish as well as to tell it to the Vietnamese community. We're glad that we have this app. We also can actually there's a chat function. So if you type a message, it'll come directly to us. And so we'll get back with you as soon as possible on that. And also about the directory, if you see we have all our locations across the state of Mississippi, and you're able to click on one, or if you want to, you can come up here to this top right corner and click map, and it'll show you which one is closer, which location is closer to you. So it's showing that I'm in Atlanta right now. I haven't allowed it to use my location right now, but I'm in Mississippi. So usually it'll be right here to tailored to the headquarters locations. And that's pretty much it. Once again, this app is free of charge. So please take a moment to just download it and share it with your friends and in your network. Upcoming announcements, our next Ask Mary and Pat show will be May 22nd at 6 p.m. Our next third parent resource chat will be May the 17th at 11 a.m. Once again, you may learn more about us at www.okhillregionalcdc.com and www.healthykidsmississippi.org. You can contact our office at 662-298-3584 or even text us at 662-689-9712. And now in my closing spiel, I'm able to add that you can chat us on the app, Oak Hill Regional CDC app or Mississippi Healthcare Help, whichever one you type in the App Store or the Google Play Store, our app will pop up. We acknowledge our board chair, Jennifer Garrett, our executive director, Dr. Michael O'Miner, and our project director, Mrs. Lottie Miner. This has been a production of Oak Hill Regional Community Development Corporation, belonging, building, and bridging in the Mid-South region and across the state of Mississippi. Have a great night, everyone.